Welcome back to Survivor's Guide to Breast Cancer, and I am Dr. Shazia Hyder, and today we're going to be talking about Survivor's Guide to Radiation. Once you are diagnosed with breast cancer, radiation may or may not be part of your treatment plan, and sometimes the oncologist doesn't really know if radiation is going to be part of the plan until after they get the pathology from your surgery. So it could be something that creeps up and surprises you, or it could be right from the start on the cards that you will be getting radiation. And of course, the less treatments that you have to suffer through, the better. But as treatments go, radiation is really like a walk in the park compared to having gone through chemotherapy and surgery. And so most people breeze through radiation with no issues, but radiation is one of those treatments which don't be fooled with, because the effects of radiation can last for months and years after you've had it. The radiation beam, depending on which site that it goes through, hits every level of you, right through your body. So it's going to hit skin, it's going to hit muscle, it's going to hit bone, it's going to hit organs, as well as the cancer plane, or where they really want to hit the area. And the purpose of radiation is to obliterate the micro cancer cells which have possibly been left behind, and to just try and make sure that they've got rid of as much cancer. This was a treatment that I really didn't want to have. Actually didn't want to have any of them, but I just read too much about radiation. But I did go through it. I would take myself to radiation every day, and I was meant to have 25 treatments. On the night of my 24th treatment, I became very unwell, and with extremely high fevers. I was really just very unwell, and I had to go into the emergency room, at which point I was admitted, and because I was septic. Now, this brings me on to my next rule, which is try not to get admitted to hospital. That doesn't mean that if you're sick, don't go to hospital. What I'm trying to say is try not to get sick in the first place, which is really difficult, especially when you've gone through radiation and surgery, and sometimes you just have to end up in hospital. There were times during chemotherapy when I probably shouldn't have been admitted to hospital because my blood pressure was extremely low, but I would make sure I drank plenty of fluids and I was eating right, and all those things matter. Your fluid intake, your nutrition, your just walking. Even through chemotherapy, I would make sure that I was walking 10 minutes a day. That's all I was told, that if I could walk 10 minutes a day, that I would be doing well, and I managed to do that. So it was quite a shock to the system, having gone through chemotherapy, surgery, and radiation, to suddenly end up in hospital for a week, and I was actually unwell for 3 weeks with high fevers, after which I suffered something called radiation necrosis, which is a known possibility of a side effect from having radiation, and it means that the radiation caused my skin to die on my chest wall, and so I had to have surgery to have that skin removed or debrided. So various side effects can range from, well, when you're hitting the chest wall, remember the organs which are under there are the pectoralis muscle, the heart, the lungs. So radiation beams will hit those areas, and you could or could not suffer damage to those organs on a small level. If the radiation beam hits the heart, then it can cause some coronary artery disease, So these are just things which can't be avoided. It's just part of having treatments and having side effects of those treatments, and going through therapies that you really don't want to go through. So, and then the most obvious one is skin, like a sunburn on the skin, which goes away eventually but takes several months. I mean, up to a year to go away. And so it's really important during radiation to use aloe vera gel, as pure as you can find, 100%, or 100% would be using the plant, or getting a 99.9%, which is what I had, gel, and applying it to the skin, which is what we use for cooling down burns. And yeah, and the most obvious side effect of radiation is also lethargy and fatigue, which the fatigue can last at various levels. For me, it lasted about 3 months, but I've known people to have fatigue from radiation lasting a year or maybe even longer. And it is so debilitating to have fatigue, because no matter how much you try to sleep it off, it doesn't go away, because it's fatigue. It's not just being tired, it's just caused by radiation. And so it is just a very difficult side effect to deal with. So these are some of the things that you can expect to deal with during radiation. If you have any questions, please post them underneath. If you think somebody may benefit from Survivor's Guide to Breast Cancer, please like this video and share it. Thank you.